Okay. I know some of these sharks are pretty massacred, but that's okay. Okay, so we'll start with some external anatomy. I know that's kind of the easier part. But we have the eye, right? What's this part of the shark called? The most anterior portion?
Nares.
Rostrum. And then under here, what are these?
Oh, that's the nares.
These are the nares, yep. So we have the incurrent and the excurrent nares. And then what are all these little pores? Yep, these are the ampullae of Lorenzini. What about this line right here? Lateral line. What are these? I don't think I asked you guys those pores, so that's okay. We can leave that. Those are mechanoreceptors. Okay, muscles. What are the top, or let's start with this. What's this?
Horizontal septum.
Horizontal septum. What is this in between? Huh? Okay, sorry. What? Not what muscles, but what is this called?
Oh, the
Tome. Myotome or myomere. And then this is the myoseptum or myosepta. Yep. Okay, and then this muscle group on the dorsal side is what? Epaxial or dorsal longitudinal muscles or bundles, sorry. And then on the bottom here is hypaxial. And then we have, this one is lateral longitudinal bundle, and then when the change in direction, this is the ventral longitudinal bundle. And then what is this right here?
Oh, that's that line.
Ventral median septum.
The linea alba.
Okay.
Yep. Okay. Let's see if we can see some of these muscles up here. What's our cheek type muscle? Adductor mandibuli. Cucularis is kind of up here. What's our levators? They're kind of up here, actually.
The anterior one is the levator palato-quadrati.
Okay.
And the posterior one is the levator hyamandibuli.
Yep. Palato-quadrati, hyamandibuli. They're kind of hard to see on the shark.
Attached to spiracles?
They're kind of right around the spiracle. Yep. Kind of hard to see, especially because we started cutting into the brain up here. No, it's okay. And then, again, adductor mandibuli. Down here we have the intermandibularis, which is hard to see. What are these going into the fin?
Flexor muscle?
Flexor, and then on top is extensors. Yep. Questions about muscles? Okay. Let's get into, how do we know this is a male shark?
Claspers?
Claspers. So these guys right here. Let's open it up. What's the first thing that we see?
Liver?
Yep, liver. This is the right lobe, right? Left lobe. And then median lobe, kind of all the way down here. What's this thing on the side of the median lobe of the liver? Gallbladder. And if you trace it, you can kind of see this clear duct running to it. That's the bile duct. And it's running along that hepatic portal vein system that we'll talk about here in a second. Okay, liver. What's this big thing? Sorry, kind of hard to keep this open. Yep, this is the cardiac portion of the stomach. We cut into it to see what it was like, right? At the very bottom of the stomach, the most posterior end, we've got this triangle. Spleen. And then our stomach upturns. What's this thing called? Pylorus of the stomach. Yep. And then here we've got pancreas, the ventral lobe of the pancreas, right? And then if we kind of dig underneath here, this thing here,
Spleen?
dorsal lobe of the pancreas. Spleen is down here, this triangle,
Right.
the darker triangle. And then dorsal lobe here. So make sure if I pin them, you have to tell me if it's dorsal lobe or ventral lobe. Okay? So make sure you do know that. And then this thing right here that I'm holding in my hand. Intestines, right? Valvular intestine. Inside we've got that spiral valve. And then where it kind of straightens out a little bit, gets a little bit more narrow, what's this thing called?
Colon?
Colon. Yep. And underneath this little finger-like projection, rectal gland. Yep. We missing anything in the digestive system?
Just the cloaca.
Oh, yeah. Cloaca is here, kind of ripped apart in this guy. Might be able to see it better in the female. Okay. Circulatory system. Kind of hard to see on this guy, actually. Let's see if I can rip it up a little bit. Okay. So circulatory system, let's think about blood flow. Where is our blood entering the heart?
From the gills.
Sinus venosus.
Through the sinus venosus. So it's the little flap here that we kind of cut through most of the time. And then from the sinus venosus, it's going into the atrium, which is like these little wing things down here. And on top, or most ventral, is the,
Ventricle.
yep. So from the atrium, we're going through the atrioventricular or AV valve, right, into the ventricle. And then we pass one more valve from the ventricle into this. What's the valve we pass? Yep, the semilunar. And then we're going into this guy here, the conus arteriosus, and then into what? Into the ventral aorta, which we can't really see too well on the shark. And then let's open them up a little bit. So from the ventral aorta, then we're going where?
So gills.
Into the afferent
Afferent.
branchial arteries. Yep.
Then efferent after.
Yep. Afferent in. And then we're going through the gills, getting oxygenated, and then we're coming out. Oh yeah, you got the good efferent. Efferent or efferent. So like get the F out of the gills. Right? Yep. Exit efferent. Efferent or efferent branchial arteries into what? Dorsal aorta. Yep. And then our first branch, you can actually kind of see, you can see the dorsal aorta really well here. And then kind of can't, this might be it, the subclavian artery. You guys won't have to label that.
That goes to the fins, right?
Yep, the pectorals, yep. Okay, and then hopefully you guys can kind of see this on the video. And then we've got our first branch that we can normally see coming into the body cavity is this guy right here. What branch is this? What artery is this? This is the celiac artery. So remember, it's going to branch 3 times. We have one going out here towards the liver. Which one's that? Hepatic artery. We have one going into the stomach, which is the gastric artery, and then it's going into the stomach and then it's kind of branching into dorsal and ventral, but just know it's the gastric. And then we have one branch coming right off here into the pancreas. That one is the close pancreatico. Yep, pancreatico-mesenteric artery. Yep. Okay. Then if we kind of flip everything out and we go a little bit more posterior, we've got 3 different branches down here too. So our first branch, which is kind of hard to differentiate here, but our first branch here is going into the intestines. This one here. What one's that? Anterior mesenteric artery. Yep. And then our second branch, which kind of looks like the first sometimes, is going into our spleen. That one is the gastrosplenic or linogastric. Yep, depending on which one you prefer. And then we have one last branch of it, basically, or one last artery going into the rectal gland. Which one's that? Posterior mesenteric. Yep. And then you'll kind of see on the kind of on the ventral side of the intestine, you see this big thing, and then it kind of runs across here towards the spleen. What vein is this? That one's the posterior intestinal vein. Yep. And it's kind of running up here, and then there's a whole bunch of other veins that we really can't see very well on this shark or on any of your sharks. And then up here is which one? This is the hepatic portal vein. So remember, the hepatic artery, hepatic portal vein, and the bile duct all kind of run with this one. Okay? Any questions on circulatory? Is that all circulatory? I think it is. Okay, and then we'll hit some urogenital. Again, we've got a male. So what is this right here? Testes. Yep. What's the anterior portion of the kidney called? Leydig's gland. And then we have the rest of the kidney down here is just the kidney, that spongy bit. What's the convoluted stuff on top of the kidney? Or ventral to the kidney? That's the ductus deferens. Yep. And then when it starts straightening out and widening a little bit down here,
Seminal vesicle.
that's the seminal vesicle. Yep. And then if we can kind of see them, they're not super full. What do we have down here in the male shark?
Sperm sac.
Yep, sperm sacs. Yep. And I think that's it for the male, right? We have claspers down here. Anything else that we're missing? So let's switch really quick. I'll get the female. Or you just gotta hand her over?
Can do
Okay,
that.
we can do that. We got the female here. This is our big pregnant female. Okay, so let's see here. So what do we have here?
Oh wait. Shell gland?
This is the ovary. And then the shell gland is this like bigger wide part here. See where it kind of widens? That's the shell gland. And this is the
Ovary tract.
oviduct,
Oviduct.
which is the ovary tract, yes. So this is where the fertilization takes place, right? Where we store the sperm in the shell gland, and then it's going down the oviduct into, yours is nice and big because she's got pups in there. What's this big thing? This is the uterus. Yep. And then again, she's kind of exploding already, but her cloaca is in here, and then the urinary papilla, kind of hard to see, but you can see it, is kind of like this little like fleshy bit right here. Okay. Did I miss anything on the female? Okay, I think that's it. Any questions over any of that? Yeah.